Today is World Sight Day, and every year this day, the second Thursday of October, is observed as World Sight Day. The theme for this year is Hope in Sight. Hope in Sight. And we have an experienced ophthalmologist as our guest today, Dr. Umang Mathur, who's the medical director of the Shroff Charity Eye Hospital, Daliaganj, New Delhi, who is our speaker today. And he's a very experienced, well-known ophthalmologist, specializes in corneal surgeries, but he's also very well traveled, well experienced. And he's one person who's been very, very pro visually impaired, or by pro visually impaired, I mean he's one of those medical professionals who believes that if sight is lost at a particular point in life, there is no need for life to stop. Life can go on. And he's going to be speaking, sharing his experience, his views, and he would be motivating us to carry on living our lives, pursuing our dreams. Today's audience includes both visually impaired people as well as professionals from the teaching and medical professions as well. So it's a mixed audience. And without taking much more of your time, I would like to hand the floor over to Umang. Over to you, Umang.
Thank you, George. And it's an honor to be here. Thank you for giving me this opportunity. Greetings on World Sight Day. I'm conscious of the fact that some of you may not be seeing very well, and vision and sight may not be something to celebrate. However, I think it becomes even more relevant to raise consciousness about it, discuss and improve the quality of life of those with vision impairment. So hope and sight, as George just mentioned, the theme for this year's World Sight Day was announced by WHO. It's very apt, especially in the gloom and despair of COVID-19. While Corona seems to have caught the imagination of the world, we must not lose sight of other ailments and provide hope and solutions to morbidity associated with blindness. And as we've been seeing just post the first lockdown, patients unfortunately are coming so late because of poor access that a lot of eyes we've lost just because of the neglect and the difficulty that patients have faced in traveling to get their eye checkup. My own sensitivity towards the capability of people with vision disability developed with the association of two remarkable people as my colleagues and co-workers from 20 years ago. One, of course, is George Abraham, and the other is Ms. Preeti Monga. They probably do not need any introduction here. And what was so remarkable when I interacted with them continues to be is their positive spirit and zest for life. Although I had been an ophthalmologist, an eye specialist in training, and then a practicing ophthalmologist for a few years, it had actually never occurred to me that I had a role to play when my scalpel, my knife did not. So in the movie Unbreakable by M. Night Shyamalan, the villain Price says, it's hard for many people to believe that there are extraordinary things inside themselves, as well as others. And a doctor can be the catalyst who can help in discovery of the extraordinary superpower within each person, never mind the vision impairment. Last week, I was seeing a young lady in my clinic. It had been over a year since I had seen her. She had had a difficult disease called Stevens-Johnson syndrome, where the eyes completely dry up after a drug reaction. I remember being extremely disappointed that I was not able to really save her vision. So when I see her, I hesitatingly asked what she was doing. And while I expected a depressed, dejected person, to my surprise, she was full of confidence, full of energy, and now living independently in Mumbai, working in Microsoft, and actually working for improving the lives of people with disability. And I looked at her mother who was sitting beside, whom I just remember as a lady sitting quietly every time she would come with tears in her eyes, looking at her young daughter turn blind. And with gratitude, she said, "You helped her become who she is." I had not realized that while we were struggling to maintain some sight, I had introduced her to learn JAWS and meet some very successful visually impaired people amongst the two that I spoke about, who inspired her to learn the skills to navigate the world independently. Unknown to us doctors, we do not realize that a doctor's words have great power that are received by the sick and their families with a unique and lasting experience. With great power, of course, comes great responsibility. Therefore, in our interaction with the patient, there needs to be focus on language, both spoken and unspoken messages we give to our patients. Association with Eyeway and George has introduced me to several bright, successful visually impaired people. Interaction with them, I realized that all of them, without fail, had visited many eye hospitals and clinics seeking cure from their blindness. The consultations usually ended in disappointment or a distant hope that one day an artificial eye or a computer chip or something will solve their problem. But they failed to get guidance on next steps on how to live today. That got me thinking, why? Why does that happen? Why are ophthalmologists to whom the visually impaired look up to for answers, not the facilitators for changing lives? By training, surgeons are expected to be the captain of the ship. In the operating room, we have to be decisive and purposeful. But there are times when you're not in control. The surgeon may not have answers. That may make him or her look like a failure. And what is the first reaction to failure? Fear. Everyone hates to fail. Failing can elicit feelings such as disappointment, anger, frustration, sadness, regret, confusion. Fear of failure is essentially a fear of shame and guilt. Shame gets to the core of our egos, our identities, our self-esteem, and we want to avoid it. And so the first mistake a doctor makes is to avoid and keep the interaction with a patient with whom he cannot treat as short as possible. Nothing can be done. With those words, we close the door on the patient. And with that, we close all hope. This is a psychological reaction to fear of failure. It is an ego thing. Secondly, empathy and compassion are probably more important than technical skill, clinical knowledge, and efficiency. I feel all doctors entered the medical profession because they had a spark somewhere to serve and reduce suffering. However, years of education focused on therapy and technical skill transfer alone somewhere takes that emotion out of that care. We do this 10, 11 years of education, and all we learn is about disease, its treatment, and some surgical skill. Can you blame the doctor for not being compassionate when he has too much to do in little time? Probably not. But sometimes efficiency is put over care. And that's how you become. Lastly, I think it's lack of knowledge. Medicine training leads you to know more and more of less and less. Quite like glaucoma, we acquire tunnel vision. A few years back, I conducted a quiz session for ophthalmologists. I was given the general quiz, which was not to have any technical, clinical questions. There were 6 teams with 2 ophthalmologists each. I asked, what is JAWS in one of the questions. The question not only passed the entire group of 6 teams, not one among the 80 odd audience could answer the question. And these were all ophthalmologists, eye specialists. There is some amazing work being done by individuals and organizations in the area of vision disabilities, but the ophthalmologist is quite unaware of it. They've never visited some of the schools for the blind, for a lot of organizations that are working on giving them skills, vocational skills, counseling, computer education. They're absolutely unaware of it. My colleague at Shroff, Dr. Javed, has written an article in the August 2020 issue of Indian Journal of Ophthalmologists, which is a scientific journal, on the role of ophthalmologists after a patient loses vision. Are we doing enough? He starts by writing, and I quote, 5 years of medical school, 3 years of post-graduation, a couple more for fellowship. That is how most of the ophthalmologists are trained in our country. After a minimum of 10 grueling years, one would think it is enough. But how much is enough, and who decides that? After all these years, when we come across a patient in our clinic who's blind without, say, light perception, are we doing enough for them? So it is clear, talent, skill, and ability, whatever you may call it, are not enough to heal the patient. Psychologists have proposed lots of different vehicles over the years. Grit, optimism, passion, inspiration, etc. They are all important. However, one vehicle is particularly undervalued and underappreciated in psychology and society, and that's hope. Why is hope important? Well, life is difficult for everyone. There are obstacles. Hope allows people to approach problems with a mindset and strategy set suitable to success, thereby increasing the chances they will actually accomplish their goal. So if you have hope, you look forward to the challenges. Therefore, when a doctor doesn't have treatment to offer, he still has to provide hope by showing the path, empathizing with the patient and motivating him or her to learn to adapt to the new world. From an ophthalmologist, the doctor needs to wear a counselor's hat. I like them to meet people like Preeti and get inspired. My friend Sanjay Dang runs the most successful travel agency in Noida after progressively losing vision before finishing school. Meeting such amazing people who overcame their disability and took life head on ignites the spark. We need to make it compulsory for ophthalmologists, at least those in training, who will be the future, to understand needs of the visually impaired. They need to spend a few days in learning what is being done in institutions for the vision impairment. Places like Eyeway, NAB, the Blind Relief Association, Silver Linings. It should become compulsory visits, like internships, so that it leaves a permanent impression in the minds of these young doctors. These interventions should be regular and frequent. It could be the other way around also. We could have institutions, people from these institutions coming to these eye hospitals and interacting with young ophthalmologists. Technology and use of assistive devices, the power of the mobile phone and Alexa have become aids to normal life. It is important that a doctor becomes a facilitator and motivates the dejected patient to gain their life back. The same article, our article in August issue of IGO, with contributions from George, Preeti and Mr. David, is like a ready reckoner for ophthalmologists to refer patients for rehabilitation and training. We've written this article for this very purpose, to reach out to ophthalmologists and have it available whenever they have a patient who can benefit from training, that they know where to send them. I feel that a lot of work is being done by passionate people for the visually impaired. There is a need to integrate and complement these services and make them scalable. The ophthalmologists and optometrists need to get integrated in this. In a connected world like we have today, we need to come out of our silos, our compartments, and work together to make life of the blind a little easier. And it needs to start from recruitment, giving them education and training, and then ultimately providing placements. And all of this need to go in sync together. It all needs to get integrated together. Use of technology could be adopted early. Children must be provided computer skills early so that they become connected citizens of the world. I think the schools for the blind probably still need to teach Braille. However, I think very quickly they need to also have computers available right from their schooling. I am actually very optimistic. I feel the young citizens, including young doctors, are today more socially conscious and inclusive in their development. With technology, it is easy to be connected, as we are doing today through the Zoom discussion that we are having. And I'm very hopeful that with all the innovations and new platforms to communicate and learn, we will have a positive impact on vision impairment. So I would say there's a little call for action that we all need to get together, including the doctors, hospitals, optometrists, to work together in this endeavor. As Helen Keller said, life is either a great adventure or nothing. So let's make it an adventure. Thank you, George.